The genesis of Shadowbox really comes from my time as a VP in a very large independent diagnostic laboratory. It was actually
Yeah.
my first foray into the healthcare space. I had done defense, I had done telecommunications, I had done all kinds of other things, obviously policy. Clearly, I can't hold down a job. But I was working at this large lab. It was very successful. And my job there was really to try and identify strategic level challenges that we weren't able to solve through standard operations, which is like an entrepreneur in residence, actually, now that I think about it.
Hey guys, and welcome to the Grow IT podcast. One of your hosts here, Greg King. And today we are very excited to have our guest, Mr. Greg Stein from Shadowbox. And as you guys know, this is the podcast where thought leaders come to talk about their niche expertise. So today we'll be diving into his story a bit as well as what his company does. So make sure to stick around for this one. But without further ado, Greg, welcome. Thanks for hopping on.
Treg, thank you very much for making me a part of this show. I've seen a few of the episodes and I take away something every time.
Yeah, man, we're having fun on this side. Greg, if we can kick things off by you just give us a bit of an introduction as well as just a bit around your background as well.
Sure. I'll try and be brief. So I'm a lifelong entrepreneur. I actually started my first business about 10 years old. I would take my
Wow.
bike to the corner store, use my allowance to buy a pack of gum. It was a quarter at the time, just to show you how old I am. And then I'd ride back home and I'd resell each of the pieces of gum to my family and friends for a quarter each. It was a great business. I was making bank until my sister decided that my prices were too high and went and complained to my mother, at which point I was introduced to price controls. And that theoretically, I believe, after all the psychoanalysts, sent me down this dark path of working in politics and public policy and legislation, which I did for about 15 years out of college. But I've always been an entrepreneur. I actually started my first, I was the founding president of the, how do I, let me reframe that, let me say, I've always been an entrepreneur throughout. I was the co-founder of the UC San Diego Flying Club in college. I was the
Wow.
chartering president of my fraternity chapter. I've always just started things. In fact, when I worked on Capitol Hill, both members of Congress I worked for were freshman congressmen, which is in essence a brand new office, and you're setting everything up from scratch. I
Right.
started multiple campaigns, political campaigns from scratch. And throughout the entire time, I was realizing that I had all this experience and didn't know what the hell I was doing as an entrepreneur. So went back to school, got an MBA, and got serious about it. And
Right.
that ultimately led me to where I am today with Shadowbox.
Excellent. Tell me, talking about Shadowbox, what problems are solved or desired outcomes does your product service offering deliver to clients?
Sure. The genesis of Shadowbox really comes from my time as a VP in a very large independent diagnostic laboratory. It was actually
Yeah.
my first foray into the healthcare space. I had done defense, I had done telecommunications, I had done all kinds of other things, obviously policy. Clearly, I can't hold down a job. But I was working at this large lab. It was very successful. And my job there was really to try and identify strategic level challenges that we weren't able to solve through standard operations, which is like an entrepreneur in residence, actually, now that I think about it. And
Right.
we were dealing with things like strategic challenges with payer policies, meaning insurance company policies, or competitive pressures from competitors that weren't necessarily acting above board all the time, or how do we get patients who owe a cash pay or a deductible to pay before the test is provided to them. So every one of these opportunities gave me insight into really how laboratories and more broadly speaking, healthcare and ancillary services operate today. And if you were to build an organization as dysfunctional as possible, you still wouldn't get to what healthcare is today. In fact, the problem that Shadowbox solves, to get to your question, is around interoperability. It's the challenge of getting good, clean, complete patient data from its
Yeah.
source of record, typically an electronic health record system, primary care, or hospital, to wherever it needs to go to perform some form of clinical service. That could be a lab, it could be an imaging, like an MRI or a PET scan. It could be you need to go to a specialist, like an oncologist, or you need to go to a surgeon, an ambulatory surgical center. the infrastructure to move that data back and forth is so non-existent and so behind the times that 90% of services today are still ordered with a fax machine. Hello 1996, they're still
That's still
ordering
happening.
with it today. So
Goodness.
Shadowbox is a breakthrough technology that essentially enables interoperability at scale. And what I mean by that is we've invented and have since patented a couple patents now, a browser. So it's Chrome, it's
Right.
Safari, it's not. It's the Shadowbox HIPAA compliant, SOC 2 type 2, this is healthcare lingo, compliant secure browser that sits on the desktop of the ordering clinic. And when they log into their EHR, their system of record, every day, instead through Shadowbox versus through Chrome or Safari,
Yeah.
what we've done is we've now enabled the extraction of discrete data, and I can get into the more technical details if you want, the discrete data that lives in that EHR. It could be images, it could be text, it could be files, and we
Yeah.
move it within the browser application to wherever it needs to go. It might be an ordering form, or it might be an actual application. And so it's secure, compliant, it's focused on what the clinic is doing every day. And the beauty of it is that it helps every stakeholder throughout the entire process. First of all, the ancillary service no longer is paying an EHR vendor to write a traditional coded integration between
Yes.
them or a third-party vendor for a hub and spoke integration. They literally are dropping the Shadowbox on top of the clinic using the EHR they already use every single day. And now there's this easy button that enables them to move the data. So no EHR vendor fees. It's up and running like installing Zoom. So it's like 2 to 3 minutes and you're up and running. Because so in turn, the traditional integration route can take weeks, months, sometimes even
Yes.
longer. And that's because
Yes.
EHR vendors, their job is not to integrate every single lab and imaging center. They are like stacked with their own responsibilities and they're
Yeah.
working as hard as they can, but they've got to put you in a queue. Forget all that. You don't need that. So instead, you're up and running in 3 minutes, essentially, once you set up the user on the back end. And the user is in the experience that they have every single day. They're not switching. Like, big challenge in healthcare is, oh, just use our ordering portal. Well, now you've got 15 tabs open and you're switching between and you're still data, keystroking. And
Yeah.
so Shadowbox eliminates that. It just moves all the data discretely where it needs to go. And then from the lab side or the imaging side, they're now getting clean, complete orders with the data that is required for them to provide a good clinical test, most importantly. But along with that, they're also getting insurance information that's as accurate as it is in the doctor's office, not after some clearinghouse or third party. They're not
Yeah.
getting it from the patient who could type it in wrong. They're actually getting it, directly from the doctor's office.
From the source.
And so they're getting good, clean, complete data, giving a good clinical result so that the doctor can provide a treatment plan based upon that as fast as possible. And then they're turning around and they're submitting it to the insurance companies. And because it's complete and accurate, they're getting paid faster. So even the insurance companies benefit because it costs $20 to $40 for them to deny a claim that they ultimately have to pay because somebody,
Yes.
switched two of the numbers in the medical record number, right? So anyways, that's a pretty long description of it. Maybe you
No,
want to
I'm
dig into
so
that
glad.
or I can share more.
No, I'm so glad you elaborated on that. Just the last point that you mentioned from a value standpoint, because even though it's like you said, from insurance point of view, even it's not directly like client acquisition cost, but in retrospect, they are clients, and this system, just because of that time that it takes away, and the obviously the correctness of the information. I mean, that sales cycle is shorter. So I'm just thinking about a way out value points, that I did not know about this. And I'm curious though, is obviously with this is sensitive information, obviously, right? That's been managed. So are you, from a HIPAA point of view, how does that work in? And I don't understand those things so well, but I'm just thinking about, HIPAA is obviously playing a big role when it comes to these type of things.
Yeah, so from a HIPAA perspective, there's multiple things that Shadowbox does that we believe is actually an enhancement and an improvement over accessing data through Chrome or Safari. Number
Right.
one is Shadowbox only opens the EHR and the affiliates that are associated with it. You're not Netflixing, you're not,
Okay.
you're not, looking at your email,
Good
which are
analogy.
all opportunities, right, for loss of productivity, number one, but number two, uh, inadvertent disclosure of patient information. Human error is the biggest source of HIPAA challenges, right? So that's number one. Number two is the data that is extracted is only the data that needs to be moved into the ordering process for the ancillary service provider, as an example,
Right.
versus the alternative, which is just send me the medical record. I don't need to
Yeah.
send you 300 pages of some chronic patient, so that I can perform a routine blood test,
Yes.
just so that I can get paid. And oh, by the way, both the lab and the insurance company have to parse through all those pages. So what Shadowbox does is it narrows down to what's called minimum necessary information. So we're actually complying with a HIPAA rule by only taking the information that is necessary. We have
Right.
customers, by the way, that ask us all the time, well, can you get this? Can you get that? And like, if it's not necessary, we're not doing it. We are compliant first. The third thing is that unlike when you are sending data through the cloud and it sits there or
Yeah.
an API or an HL7 where there is a potential for intermediaries to intersect,
Yeah.
Shadowbox is transferring it within the browser layer on the desktop. So we're actually a more secure, more compliant,
That's actually more secure. Mm.
and on top of that, because we're a distributed architecture, which means that everything's not going to a single data source, a data lake, and we're not storing a ton of information, that if something should happen at the end user site, they get hacked. It doesn't affect anybody else. It's
Yeah.
walled off by its architectural design. I can't tell you that was purposeful when we did it, but as
Yeah.
we started thinking about it, we saw what happened with Change Healthcare. We
Yeah.
realized that this is actually something that's incredibly powerful as part of our infrastructure.
That is so, that's profound. I was counting on my fingers from a value point of view, specifically now towards, well, not just HIPAA, but I'm talking about just functionality and the value that you guys bring just from a better production, less human error is a big factor. As well as obviously operational cost coming down, from that as well, and only that necessary information, determined on obviously what needs to take place from a medical point of view. Tell me the if you don't mind, can you possibly share? You don't have to give obviously the company's name. I don't want to get anybody in trouble here, but a client that you've assisted that's been, let's say, running on that fax machine, right? That's maybe a good example. Running on that fax machine or some sort of legacy system, or that you guys went in and they implemented Shadowbox, and it changed their business.
Yeah, I'm happy, and they're more than willing to let me share their name. Our very
Oh,
first
please.
customer, very
Oh,
first
excellent.
customer,
Please do. Please do.
a small independent lab here in San Diego, where we're based as well, and they were a startup, so they were just getting going, and they could not afford to do traditional HL7 integrations or pay for these third-party vendors, so they
Right.
started on fax. And so they would either get a fax or they get a paper that came with the specimen in the UPS in the morning, right? And then they would run that, and they were doing 20 specimens and then 50 specimens and then 100 specimens a day, right? And as that
Yeah.
volume kept coming, the volume of paper kept growing. Now, what does that mean? That means that they had missing information. Is it John Smith or John A. Smith or John B. Smith? They had incorrect information, 1978 or 1987, right?
Oh
They
goodness.
had a line through a list of tests that are on their order form by the
Yeah.
doctor. Is that one test? Is it three tests? Is it all these tests? It kind of squiggles here. Do I not do that test? And on and on and on. And so they had to hire people to spend their entire day, every day, calling practices and saying, I really need to clarify what this test is for.
Yeah.
And so, and by the way, every lab has some division that is still dealing with some form of fax or eFax. Every imaging center still is.
Mm.
Our mission is to get rid of the fax.
Yeah.
But what we did is when we installed Shadowbox in the very first practice, when I knew we had something real was when the very first practice we installed it. It opened up this person's EHR. Their job was to order and result labs, and she clicked the easy button, and it popped up an order form. She's like, "Oh, it's just like the paper form, except it's already filled out. This is going to be awesome." That was the response. So we knew we had something that was good for the whole chain, everybody, all the stakeholders, right?
Yeah.
Then we did a case study with them after they've been using us for about a year. We found out that every practice that they converted from paper and fax to Shadowbox reduced errors coming in the front door by over 90%.
What?
Over 90%.
That
That means
is
they get a better
excellent.
clinical test because they're actually testing for the right
Yes.
thing. They get a better response faster back to the patient because they're not putting something on hold, waiting to find out what they're supposed to be testing for.
Yes.
And they also get paid.
Yeah, because
You
like you
have,
said, even those insurance, those claims, those things get that the process gets, it speeds up. Um, Goodness, that is what a story. What a story. Greg, if we can maybe step back a bit and just about talking about you and Shadowbox. Obviously, when you started this specific business, I mean, you've got an interesting background of how you got to Shadowbox. It's not the traditional one, I would say. Um,
I
I,
don't recommend it for
I
anybody.
don't, yeah. So I think it will make an interesting read, though. But obviously the road is always not rosy, and there's always challenges when it comes to growing a company, right? And do you mind sharing maybe one or two things that when you started to grow the company, some challenges that you might have faced, and what you had to do to break through that glass ceiling, if we can call it that.
Sure. First of all, innocence or ignorance is innocence, or ignorance is bliss. I don't know the right saying, but
Yeah.
I went into building this company. I had been involved with several successful startups of one form or another, as I've described. Yeah,
Right.
although from early days all the way through. Also, lots of failures too. So I'm certainly not hitting 1,000.
Yeah.
Um, but when I started Shadowbox, I had assumed that because I had the background I had in healthcare and specifically in lab and using a technology that I had a very rough MVP, that people would just say, wow, I get it.
Mm.
And that was not the case. And not the
Right.
case at all. The technology will never work. That was number one. And then we started to prove it worked. The technology will never be used. Nobody wants to actually use this. It's different, right? There's this huge hurdle of getting people to use it. And then people started using it because it's actually easy enough to use. The
Yeah.
third was, well, nobody's going to pay for it. And then it was like, well, then people started paying for it. And they're like, well, you're never going to compete against Google and Safari, or, Chrome and Safari. I'm like, we're not competing with them. This is a browser for enterprise. Sorry, this is a browser for healthcare. It's more of like an enterprise browser, which, by the way, didn't exist at the time.
Right.
That whole category of companies didn't exist, or solutions didn't exist at the time. But what my takeaway was is that I didn't let anybody ever tell me that what I was doing was impossible or I didn't. How do I phrase this? And by the way,
Yeah.
you need to edit this because it isn't very fluid.
No, sure.
I I think the takeaway is that if you're going to be an entrepreneur and you're going to build a business, and quite frankly, it's an entrepreneur with a brand new business. It's somebody coming into a business as a manager that is looking at an existing business and trying to help it grow,
Yeah.
or you're in a business and you get an opportunity to start a new, be involved in a new. Every single time, you're going to face so many challenges about all the things that you don't know, and you've got to
Mm.
have the fortitude, you've got to have the grit, and probably most importantly, you have to have humility. You have to
Right.
be willing to have somebody tell you, you know what, it's not going to work, or it's not this, or it's not that. And even if they end up being wrong, it gives you an opportunity to reflect on what they're saying
Yeah.
and take something away from it.
That
Like I,
that's such good
even
advice.
when they're wrong, right?
Yeah. Yeah. The tell me, Greg, for this year, what's on the horizon? What plans are on the horizon? What's going to happen this year for Shadowbox?
Very excited about what's happening this year.
Right.
So we started off serving the diagnostic laboratory industry, because that was my background and my
Yeah.
network of relationships. And we survived COVID. We survived the removal of funds from COVID, which 50%, about 50% of small independent labs closed shop after the funding for COVID went away. So
Goodness.
a very, very rough
Good.
market. So
That's a
in
high
the
percentage.
Yeah, it's huge. In the lab space, we are now being seen as an opportunity to not only grow and compete, but survive. because of the value proposition we provide. So in the lab space, we're seeing a lot of excitement with our prospects and existing customers and a lot of utilization.
Right.
Just we grew transaction volume in January alone by 18% over December, and which is massive for us. We had been sort of, moving along sort of in lockstep with our number of customers and installations and all that, but that was an exponential jump. The second thing that is exciting about 25 is that we started getting serving in the imaging industry, and we now have customers that are using our services and solutions in imaging, and by that I mean mostly freestanding imaging centers that do MRIs, PET scans, mammograms, those kinds of things.
Right. That's exciting.
It's very exciting. They have very similar challenges, somewhat different workflows, different business, but as compared to lab, where there is a lot of integration because it was a necessary tool for doing business, and people just sucked it up and invested in it. In imaging, it's a wide green field. Nobody's integrated,
Yes.
unless there's a hospital and a JV, and that's it. Everybody else is using EFACs, and so the opportunity to really add value at scale is really exciting. So that's number two. The third is that we upgraded and released our clinic-facing application last year, which is, I think, part and parcel with the growth we've seen. But this year we are launching an upgrade to the back-end user management portal. And what we're adding to that is this whole range of statistics and value for our customer, which is the lab, the imaging center, and so on, to know what's happening all the time. So it's a business
Like
intelligence.
updating. Right. Right.
Now they
Jeez,
actually
that's quite
know.
unique.
Oh, it's
That's very unique.
well, thank you for saying that. We think that it is going to be a game changer, because if you think about, just there's lots of churn in clinics ordering from, I just keep going back to lab because that's most of our customers today. But clinics will order from a lab and then they won't. Clinics will be ordering 500 tests from that lab and then it starts petering down. But the lab doesn't really know that because they're not looking at it with that sort of dashboard formatted incremental data that enables them to say, you know what, I need to send a sales rep out there or a clinical rep out there and find out what's going on. Is that practice getting, is the person retiring? Perfectly natural. Are they getting bought by private equity? Happening all the time. Or did they have turnover in their staff and they don't realize that this is a critical test that is often ordered with these patients? Right. So there's all kinds of reasons why that volume. So before that customer before it dries up completely, and they're like, why is there a Shadowbox?
Yeah.
Right. Now they're like, I'm going to go out there and talk to them and give them some clinical information, give them some an opportunity to refresh on, maybe they don't have kits in order to send a specimen. There's lots of reasons. So anyways, that's what's exciting about that. And then the growth in imaging. And then there's some other things on the horizon I'm not ready to talk about. Except I'll say we just filed our third patent.
I'm definitely gonna get you back for. I'm definitely gonna when that hammer drops. I'm definitely gonna hit you up again.
Oh, cool.
Time. I was just thinking now. I won't be surprised. If you come on again and you share the new things that's happening in the future, and then you tell me as well that you decided to like start this secondhand fax machine shop of all these you replaced. Then I won't be surprised.
That's a good idea.
Any case, but Greg, well, first off, what's lovely talking to you. Thanks for coming on and willing to share your knowledge and your expertise. And I'm sure there's a lot of people that make some notes on, what it comes down to what it takes to build a company like this. And I can fully understand, given all the value that you provided today, and I now understand what it specifically is, what Shadowbox stands for, and what you guys do. It makes to me just sense why you guys are growing from strength to strength. So I wish you guys all the best and thanks for coming on. And before I let you go, can you please, just tell the audience where can they get hold of you guys?
Sure, we're at shadowbox.com. Best way to
As
find us.
easy as that.
As
Excellent.
easy as that.
Yeah, one needs to make those things easy, right? So, Greg, this was fun. Thanks for coming on.
Thank you so much for having me. I really enjoyed the conversation, Trey.
Thank you.